And welcome back to the show. For 135 years, University Settlement has collaborated with the community, pioneering highly effective programs fighting poverty as well as systemic inequality. Now, the organization infuses a commitment to civic engagement, equity, and communal action in each of its programs. And we're pleased to have joining with us here on the show the Associate Executive Director of Mental Health and Wellness at University Settlement, Mary Adams. And Mary, thank you for being with us and for your organization. It's a long-standing commitment to really addressing some of the greatest ills that affect our society.
Thank you for having me, Darren. We appreciate being able to come on and speak about University Settlement and the work that we're doing in the community.
And as we talk about the work that you're doing in the community, I know that really dealing with the issue of poverty, and then I'll talk a little bit about mental health and wellness. But maybe I didn't do a good enough justice. But give us a little bit more of a background into University Settlement.
Well, Darren, as you said, we have been around a long time. We were established in 1886 on the Lower East Side of Manhattan and we're the first settlement house in the United States. We bring the values of the settlement house movement forward to the 21st century, really through fighting poverty and systemic inequality. That means really responding to the needs of the community and advocating for those needs with the community. Our services really then span all ages from newborns to older adults and have gradually grown a comprehensive menu of services, again, out of the needs of that community that include providing food, education, cultural activities, learning and literacy, and of course, mental health services.
Yeah. You talk about providing food. I know that coming out of this pandemic, a lot of New Yorkers really had to deal with the issue of food insecurity. Talk to us about how that worked out for you in terms of being able to deal with food during a time like this.
You know, that was really quite a challenge in the beginning because of manpower, but University Settlement has historically really drawn a lot of our staffing from the community. And so that gave us a pathway to having staff and people available to increase the ability to get food out to vulnerable community members. And we did increase our food and our Meals on Wheels programs and food for the elderly, and we're able to really meet the needs in the communities where we are serving.
Yeah. Mental health is a big challenge for so many people, mental wellness, and having the services out there to be able to deal with such. Can you unpack for us a little bit about the services that you provide and how it's been so instrumental in the community?
You know, more than 65 years ago, university identified a need for mental health services when people were coming back and returning from World War II and were showing up different and looking differently. And we opened our first mental health clinic on the Lower East Side to help the members of our communities that were serving with shell shock, better known as PTSD today. Over the years, we have really grown a continuum of mental health services that fits our community's needs. So again, bridges children, adults, individuals, and full families. And continuously, we've identified gaps in services and aimed to fill those gaps with customized services or giving us the ability to customize services. Often people don't need therapy as much as they need skill building, ways to manage time or parenting stress. We understand the role that poverty and intergenerational structural racism has played on wearing people down so that that can show up as a mental health problem, but also needs the supports of care coordination. We have a home-based crisis program for children and families that are being impacted more intensely by a child's psychiatric problem. But our goal is to go in and build on the strengths of the family and keep children at home rather than becoming system involved. We recently, in 2019, expanded our menu of services through a New York State Medicaid redesign initiative called Children and Family Treatment Support Services. That gave us new ability to go into the community and serve children and families and be able to bill for those services, something previously unavailable, but then gives us the ability to go in and serve people where they live, where they work, where they feel more comfortable. And again, retrofitting services to meet what they really need. So maybe intervening in a crisis, but not necessarily involving a hospital or a psychiatrist as much as self-regulation and strategies for de-escalating crisis. So that continuum offers us the ability to meet families, children, and individuals where they're at and really customize services.
So when we talk about keeping kids at home, I know that was very much a priority of, crisis intervention, how you could actually keep a child at home through the work that goes on there. Can you give us a little bit more about that? Because I think that so many people underplay the value of that. Because when you look at a lot of our children who end up in the system or, finding themselves on the other side, it's sometimes because of a lack of access to services. But here it is that you got a great crisis program that really has that as the aim and the focus. How successful has that been for you?
It's really a game changer being able to build on the strengths of a family and then add in or take away services as they are needed. So a hospital can be the right strategy for a real psychiatric crisis. But often what we understand is that the pressures or the stressors on a family can look very serious. But when we go into those homes and work with those families and the children, there are always enormous strengths and capabilities to build on. Having customized services, so what I mean by that is we do have a home-based crisis program, but they have the capacity to reach back into university settlement and say, but we also need some individual therapy for this child, in addition to just crisis intervention. And mom needs some positive parenting support, some strategies to manage things in the long term with her children. So that's the ticket here, is being able to first meet with families and understand what the challenges are, and then what the strengths are to offset those. Then integrating the services that can really build on those strengths to work for that particular family. Then there's no need to really take the child out. And that's what you want, is you want the family to be able to work through and work out these problems on their own, because that's a sustainable answer that works for the long term.
Mary, tell me about this. When we talk about where you are as an agency right now, and you talk about the services that you provide, we know that they've been battle tested, right? Because of COVID. And we know that COVID has further elevated people, whether it was food insecurity, the need for counseling, things of that nature. Give us a little insight into your organization, how you've had to navigate throughout the course of the past year, because I am assuming that you've had more cases than ever before. And at the same time, still trying to keep up with staffing and everything else that comes along with running the organization.
Yeah, so the last few years have been very, very complicated. I will say that, and I mentioned before that university settlement has reached within the community to hire staff. And we have a long track record of then holding on to staff, growing them, and lifting them up and promoting them from within. So we have some very long-term staff here, which means they know the community, they know the families. That gave us a real edge here, because we weren't walking into anything strange. We understood what was happening in our community, and families have a certain level of trust and are able to reach out to us. So this was a huge advantage. The other thing that played in our favor here was we had already applied for and been designated for the additional children and family treatment support services. So we already had these services up and running, which had given us additional capacity. When the pandemic started, We did go into a lot of virtual services, but all of our services remained hybrid and we went into the community and in person when needed. So I think the flexibility with our continuum of service was an advantage. I think that our history in the community and the trust that we have as a provider was an advantage. And in fact, you're right. We had huge increases in our care coordination program that we operate in New York City, and our mental health clinic, our home-based crisis. All of these programs really had huge increases, which we believe is a good thing because it means that we're trusted and that we can continue to support these families in their communities.
Yeah, and I think it's great because you have an accessibility to services, which is what a lot of people need. And for yourself, your organization serves about 40,000 people between New York and Brooklyn every year. That's a lot of people, and
Yeah.
to have a stable staple, and also someone that's stable in the neighborhood really means a lot. So for somebody who wants to get connected to some of the services that you have, what's the best way for families and or individuals to get connected to you?
One of the best ways is to go onto our website, which is www.universitysettlement.org, because our website will give you a list of all of the programs. They have contact information, phone numbers, email addresses, and they can also help you weave through what might be the right service for you and sort of where it's located and how to access that. So that really is our best service. You also can always call our mental health main line, which is 212-453-4522. And we can always help you at that central number get to any of our programs for mental health services and supports.
Yeah. Well, Mary, we have to leave it there, but I want to thank you so much for being with us and sharing. And of course, the great work that you are doing. Over 40,000 New Yorkers between New York City and Brooklyn receiving services from University Settlement. Thank you so much for being with us.
Thank you very much for having us.
All righty. And so if you want more information, don't hesitate to visit the website, as mentioned, universitysettlement.org. And then also, you can also visit them on social media as well. And you can have an opportunity to find out about the great services University Settlement provides. Thanks to Mary. And we want you to stay with us because guess what? We do have more open coming up. Don't go anywhere. We're returning right after this.